The modern emergency ambulance system in the United States did not appear overnight. It developed through decades of medical research, government action, and public health reform. In the early 20th century, many American ambulances were little more than transportation vehicles. Funeral homes often operated them, and most had minimal medical equipment. Patients injured in car crashes, industrial accidents, or other emergencies were usually transported quickly to hospitals, but trained medical care during the ride was rare. A major turning point came in 1966 with the publication of a landmark report titled Accidental Death and Disability: The Neglected Disease of Modern Society. The report was released by the National Academy of Sciences and the National Research Council. It revealed a serious problem. Tens of thousands of Americans were dying each year from injuries that might have been survivable with faster and better emergency care. The report compared trauma deaths to a hidden epidemic. It showed that emergency response systems across the United States were poorly organized, ambulance crews often lacked medical training, and communication between hospitals and emergency vehicles was inconsistent. The findings prompted action from federal and state governments. In 1966, the U.S. Congress passed the National Traffic and Motor Vehicle Safety Act and the Highway Safety Act. These laws encourage states to develop modern emergency medical systems and improve ambulance services. Federal funding began supporting better equipment, standardized training, and communication systems. During the late 1960s and early 1970s, several pioneering programs demonstrated what modern emergency care could achieve. One of the most influential examples began in 1967 in Pittsburgh, Pennsylvania, where a group of specially trained paramedics started responding to emergencies with advanced medical equipment. Their work proved that life-saving treatment could begin before a patient reached the hospital. Cities across the United States soon began adopting similar systems. Ambulances were equipped with oxygen, defibrillators, and communication radios. Emergency medical technicians, known as EMTs, received standardized training to provide immediate care at the scene of accidents. By the 1970s, the modern emergency services framework was expanding nationwide. Dispatch systems improved, paramedic programs spread, and trauma care became more coordinated between ambulances and hospitals. Today, the American ambulance and EMS system responds to millions of emergencies each year. Its development, sparked by research, federal policy, and medical innovation, fundamentally transformed how trauma care is delivered in the United States, ensuring that critical treatment often begins within minutes of an emergency.